Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over the 3 most effective treatment to fix carpal tunnel syndrome or relieve carpal tunnel syndrome. It's very important to understand these 3 treatments has to be done simultaneously for the best result. So before I go over the most effective treatment for carpal tunnel syndrome, we need to understand the normal healing cycle so it will make sense how to get to the root cause of the carpal tunnel syndrome and treat it effectively. I'm gonna use external paper cut for visualization, but the same process happened internally in the carpal tunnel syndrome, but we don't see it because it's deep in the joint. So the first stage of healing is it's called the inflammation stage. As you can see here in the first image, swelling, redness, the blood starts to rush to that area and you start to have pain and decreased function. And when that happens here, it compresses on the median nerve, the yellow color here, that's a median nerve. And when you have compression there, that you will start to experience the symptoms of carpal tunnel syndrome. Second stage of healing is called the proliferation stage. During the proliferation stage, there is a cascade of events including fibrotic tissue, fascial restrictions, muscle spasm, trigger point. As you can see it here in this image, your body starts to build a scar tissue. If our body does not build a scar tissue, it's open wound susceptible for infection. So it's actually scar tissue or fibrotic tissue is very essential for our survival. The problem is when we have too much of the fibrotic tissue that is in the way of everything. And for carpal tunnel, when you have those fibrotic tissue, it's going to compress on the median nerve here, and you start to have the numbness and tingling symptoms of the carpal tunnel syndrome. In perfect scenario, actually during the maturation stage, your body should get rid of the inflammation and anything here in the proliferation stage. That could take weeks, days, months, or years. Chronic carpal tunnel syndrome symptoms usually happen when the patient experiencing this chronic vicious cycle that the body going back and forth between the inflammation and proliferation stage. And as you see here, this is a very complex structures that you see the transverse carpal ligament, and you have a lot of tissue inside here. So any excessive inflammation or fibrotic tissue, it's easy to compress on the carpal tunnel and cause those symptoms. So to treat this effectively, we have to break that vicious cycle. Before I go over the proper treatment, I will go over the current treatment that does not work based on the studies. So it will make a lot of sense why you should not waste your money and time on those treatments. And I will leave a link underneath this video for the research that indicated these treatments either provide short-term pain reduction or no pain reduction. And we'll relate this to the normal healing cycle, so it will make a lot of sense why it does not work. So the first thing is ice and heat. Ice is actually temporarily decrease inflammation, but will not do anything to break down the fibrotic tissue, the fascial restriction, or it's not effectively going to decrease the inflammation. The same thing with the stem, it's temporarily for pain relief. Foam roller massage is actually rubbing over this area could cause more inflammation and more pressure that will cause fibrotic tissue and fascial restriction. So it actually could make it worse. The other treatment that been used, acupuncture, dry needle, it will not do anything to the fibrotic tissue or the fascia system. And when I go over those systems, it will make a lot of sense those treatment is not effective. The other thing that's used in healthcare providers, by healthcare providers, joint mobilization does not make any sense here to move the joint because you have inflammation and fibrotic tissue. That's not gonna resolve it. That's actually could cause more symptoms. Stretching, and actually studies shows that excessive stretching could cause micro tear in the muscle and cause more inflammation. Is actually, I don't recommend it to my patient, and you will see on YouTube there's a lot of videos about stretching, which is actually could cause the symptoms to get worse. And the other thing that's mostly common is strength exercises. Actually, one of the triggers for carpal tunnel syndrome is actually repetitive strain injury. So when you do more strength exercises, it actually could cause more inflammation and more strain and make your symptoms worse. To really get rid of the carpal tunnel syndrome, we have to look at the healing cycle and break that vicious cycle. So the first thing I usually do with my patient is decreasing the inflammation. It's very common to have with those patient inflammation. So at home, if you have the carpal tunnel syndrome, rest is very effective if you have acute stage that uh, give it a time like a week or two, 2 to 3 weeks max. If you notice the symptoms decreasing, that's an indicative of acute stage of carpal tunnel syndrome. And if it's resolved, that's great. If it has not resolved, that's an indicative that you have the chronic condition of severe inflammation and you have a lot of issue with fibrotic tissue. So if your symptoms has not resolved in 3 weeks, get worse or not decreasing, that's a sign of that vicious cycle of chronic inflammation and proliferation issue. So what I personally do with my patient is I gave them the MagnaHeal 2. This is very strong magnet. The magnetic device is actually, the range is actually 3 to 4 inches that penetrate the body. So I have them to wear it at night or throughout the day to decrease internal inflammation, localize inflammation. And it's very common with the carpal tunnel syndrome that those patients are on inflammatory diet. When you have inflammatory food in your diet, that cause the internal inflammation in the body. So I like to put those patients on anti-inflammatory diet. So this way we decrease the inflammation from the localized inflammation and also the internal inflammation that caused by the food. For the severe carpal tunnel syndrome, patient, usually they have a severe deficiency in vitamins and mineral, and it's very important to actually evaluate their nutrition because you need vitamin D, magnesium, C, K2, and other vitamins and minerals for your body to go from an inflammation stage to proliferation stage to maturation stage. And when you watch my videos about the causes, you will see there is a deficiency that cause issues with those normal healing cycle that actually could trigger the carpal tunnel syndrome. So what I like to do is a comprehensive nutrition evaluation, looking at the vitamins and mineral and making sure that the patient does not have any deficiency that slow down their normal healing. As I mentioned to you, it's very important to address these three elements simultaneously. You cannot pick and choose to work only on inflammation and assuming the body will get rid of the fibrotic tissue and fascial restriction for chronic condition. We have to simultaneously work on those elements. So the second treatment that we have to be addressed at the same time is the fibrotic tissue. So you can see here in the first image here, the muscle is normal. There's nothing is affecting the muscle here. The second image here, when we have a tear, it's look like this. When you have fibrotic tissue, the body build the fibrotic tissue, it's look like this. It's very random tissue. The problem is you don't have enough room in the carpal tunnel here to have that excessive fibrotic tissue from repetitive strain injury, from diseases like diabetic or hormonal imbalance or other risk factor that cause carpal tunnel syndrome. So too much fibrotic tissue is going to compress on your median nerve and will cause that symptoms. So what I personally do with my patient is I use A3 to release the superficial scar tissue on the carpal tunnel. And then I use the A5 and I go through the whole area to release the fibrotic tissue. And I will leave link underneath this video on how to get those tools so you can use it at home. At the same time, while we're working on the fibrotic tissue, we have to release the fascia system. This is extremely very overlooked by healthcare providers because there is not much education in the healthcare system on the fascia system and how effectively how to be treated effectively. So next time when you go buy meat, look at the white filament. That's the fascia layer. To make things complicated, but don't worry, the treatment is very simple. Fascia system is divided to two major categories, superficial and deep fascia layers. And the deep fascia layer is actually divided to 4 subcategories: apoptotic fascia, epimysin, premiysin, and endomysin. And each of these layers has 2 to 3 sublayers on the top of each other. So as you can see it here, the white filament is the fascial layer that's in the cadaver. And when you look at your palm here, you have the palmar apparatic fascial layer here. So when this fascial layer is tight, it's like you're wearing a t-shirt 2 to 3 size too small. So the superficial layer wrapping the entire body, the apparatic fascia wrapping a group of muscles, and then you have the epimysin and the premiysin. The epimysin that wrapping each individual muscle fiber, the premiysin wrapping a bundle of fiber muscle, the endomysin actually wrapping each individual muscle fiber. So it's very important actually to release all these fascia layers. As you can see it here, you have the apparatic fascia. We have to release it because when that's tight, it's compressed on the carpal tunnel and decrease the space that could cause the radiculopathy pain. So what I personally do for carpal tunnel syndrome, I actually use the A1 to release apparatic fascia, epimysin, and superficial fascia layers on around the carpal tunnel area. And I use the A5 to release the epimysin, premiysin, and endomysin. For chronic carpal tunnel syndrome, it's very important to address these three elements simultaneously. You cannot pick and choose. I'm going to work only on the inflammation to decrease the swelling because that will not break the adhesion, the fibrotic tissue that's around this area. It will not release the different layers of the fascia system that actually contribute into the symptoms. So it's very important to address all those three issues simultaneously for the best result. And I will leave a link below for the tools on how to use it at home to relieve or fix your carpal tunnel syndrome. If you have any question or comment, leave it in the comment section. I will answer it in a future video. We'll see you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to asterinstitute.com.